Patient Care Technician versus CNA. Welcome to the quiz. Question 1. You are working on an isolation unit where several patients require droplet precautions due to suspected respiratory infections. You have received training on infection control and understand the importance of preventing transmission of infectious agents to yourself, other patients, and members of the healthcare team. During your shift, you are caring for a patient who is on droplet precautions and requires assistance with oral hygiene and eating. Based on current infection control guidelines and recommendations for preventing the transmission of infectious droplet-borne pathogens such as influenza and other respiratory viruses, which of the following best describes the most important personal protective equipment and technique you should use? Option A. Wear only standard gloves on your hands without any facial protection, as the gloves will protect you from respiratory droplets, and you can wash your hands after care without removing gloves first. Option B. Wear a surgical mask or appropriate respiratory protection when you are within 3 to 6 feet of the patient, as respiratory droplets typically travel only a short distance through the air before falling to surfaces. And ensure your mask is properly fitted and covers both your nose and mouth. Option C. Wear a clear plastic face shield that covers your entire face, but does not wear a mask, as the shield will protect you from all infectious agents, and you do not need to wash your hands if you are wearing the protective equipment. Option D. Wear gloves and a gown, but no mask is necessary, and you can touch your face and other areas while wearing contaminated gloves as long as you wash your hands at the end of your shift. The answer is B. For droplet precautions, a mask is required when within 3 to 6 feet of the patient. Option B correctly describes this. Option A is wrong because gloves alone do not protect mucous membranes from droplets. Option C is wrong. A face shield without a mask does not provide the needed respiratory protection, and hand washing is still essential. Option D is wrong. A gown and gloves are part of contact precautions, but for droplet, a mask is key, and touching your face with contaminated gloves is never acceptable. Question 2. During your morning assessment rounds, you observe that Mr. Charles Watson, a 70-year-old male patient who has a urinary catheter in place, appears to be uncomfortable and anxious. When you check his catheter bag, you notice that despite the fact that the patient has had adequate fluid intake over the past 8 hours, there is no urine present in the collection bag. The tube appears to be connected properly. The patient denies pain at the catheter insertion site, but he does complain of discomfort in his lower abdomen. The catheter insertion is secure, and there is no evidence of kinks, bends, or obstruction in the tubing visible to you. Given these clinical findings and the absence of expected urinary output, which action most appropriately addresses this situation? Option A. Assume that the catheter is functioning properly and that the patient is simply not producing urine at this time. Do not report the finding, document that the patient had no output, and continue monitoring for the next few hours to see if output appears. Option B. Report this significant finding to the nurse immediately, as the absence of urine output in a catheterized patient can indicate catheter obstruction, infection, or other serious urinary complications that require prompt assessment and intervention. Option C. Increase the patient's fluid intake immediately by encouraging him to drink more water and wait 2 hours to observe if urine output appears before deciding whether to report the lack of output. Option D. Reposition the patient several times and observe for a period of 2 hours before reporting the finding, and only notify the nurse if the patient complains of increased abdominal pain or if you observe fever. The answer is B. A catheterized patient with no urine output for 8 hours despite adequate intake is an urgent situation. It could indicate a blocked catheter, which can lead to bladder distension, kidney damage, or infection. Option B is correct. Report immediately. Option A is negligent. Assuming no urine production without investigation is dangerous. Option C delays necessary intervention. Increasing fluids could worsen bladder distension if the catheter is blocked. Option D also delays reporting. Waiting 2 hours could cause harm. The nurse needs to assess and possibly irrigate or replace the catheter. Question 3. You are in a training session reviewing proper hand hygiene techniques, and the instructor is emphasizing the critical importance of appropriate hand washing in preventing healthcare-associated infections. The instructor is asking questions to assess staff understanding of proper hand hygiene practices. You are asked how long you should vigorously wash your hands using soap and running water, including cleaning under your fingernails, between your fingers, and all surfaces of both hands, in order to effectively remove microorganisms and prevent transmission of infectious agents. Option A, you should wash your hands for only 10 seconds, quickly rubbing soap over the surface of your hands before rinsing under running water. Option B, you should wash your hands for approximately 15 seconds, which is usually enough time to remove most visible dirt and some microorganisms from the surface of your skin. Option C, you should wash your hands for at least 20 seconds, using soap and warm running water while scrubbing all surfaces including under fingernails, between fingers, and the backs of your hands to effectively remove microorganisms. Option D. The answer is C. The CDC recommends washing hands with soap and water for at least 20 seconds. Option C correctly states this. Option A, 10 seconds, and Option B, 15 seconds, are insufficient to effectively remove pathogens. Option D is not provided in the PDF. Question 4. You are assigned to care for Mr. Edward Murphy, a 65-year-old male patient who is recovering from major abdominal surgery and is on bed rest. He has expressed to you that he is anxious about using the bedpan or commode because he is concerned about his privacy and feels embarrassed about his bodily functions. He has asked you to help him, but he is clearly distressed about the process. You understand that maintaining patient dignity and privacy during elimination care is essential for promoting comfort and maintaining the therapeutic relationship. When assisting a patient with toileting and helping ensure both their privacy and their dignity, which approach represents the most appropriate and respectful method? Option A. Leave the bathroom or curtained area completely open with the door wide open while the patient is using the bedpan or commode, so that you can observe him and ensure nothing goes wrong, even though this may compromise his privacy and dignity. Option B. Close the door and draw the privacy curtain around the patient's area. Step outside the immediate area unless the patient specifically requests assistance. Remain nearby to respond quickly if the patient calls for help, and return promptly when the patient indicates he is finished. Option C. Position yourself directly facing the patient while he is using the bedpan so that you can monitor him closely throughout the process, reassuring him that your presence will help him feel safer and more secure. Option D. Ask a family member to remain in the room during the patient's use of the bedpan or commode, explaining that this will help the patient feel less alone and anxious about the process, and this maintains dignity by having someone the patient trusts present. The answer is B. Respecting privacy during toileting is essential. Option B is correct. Closing the door/curtain and stepping out unless needed preserves dignity while ensuring safety. Option A is wrong. Leaving the area open violates privacy. Option C is wrong. Staring at the patient during elimination increases embarrassment and is not necessary. Option D is wrong. While a family member may be comforting, the patient might still feel embarrassed. The best practice is to give privacy and allow the patient to call when ready. Question 5. You are reviewing laboratory results and vital signs for the patients you are caring for today. You are performing vital sign assessments on several patients and need to evaluate the findings to determine which results fall within normal ranges and which might indicate a problem that should be reported to the nursing staff. When reviewing a patient's vital sign assessment results, you obtain the following findings: blood pressure of 125/80 millimeters of mercury, mmHg, heart rate of 70 beats per minute, respiration rate of 16 breaths per minute, and a temperature of 101.5 degrees Fahrenheit, 38.6 degrees Celsius. Based on current knowledge of normal vital sign ranges and what constitutes an abnormal finding that requires immediate attention and reporting, which of these vital signs should be reported to the nurse immediately? Option A. The blood pressure of 125/80 mmHg is elevated, and should be reported immediately, as this indicates the patient may be developing hypertension. Option B. The temperature of 101.5 A degree F, 38.6 A degree C, should be reported immediately, as this indicates fever, which can indicate infection or other serious medical conditions that require evaluation and treatment. Option C. The heart rate of 70 beats per minute is slow and should be reported immediately, as tachycardia might develop at any moment and needs to be prevented. Option D. The respiration rate of 16 breaths per minute is normal and all vital signs appear normal, so no reporting is necessary and the patient is stable. The answer is B. A temperature of 101.5 A degree F is above normal, 98.6 A degree F, and indicates fever, which must be reported so the nurse can assess for infection. Option B is correct. Option A is incorrect. 125/80 is slightly elevated, but not critical hypertension. It does not need immediate reporting unless it's a trend or symptomatic. Option C is incorrect. A heart rate of 70 is normal. Option D is incorrect because the temperature is abnormal. Reporting is necessary. Question 6. You are providing personal care and hygiene assistance to Mrs. Dorothy Williams, an 80-year-old female patient who is hospitalized for acute illness and requires complete assistance with activities of daily living including bathing, grooming, toileting, and dressing. You know that providing bed bath care is not merely a routine task, but rather an important opportunity for comprehensive patient assessment, skin examination, and promotion of comfort, cleanliness, and psychological well-being. In considering the purpose and goals of providing a complete bed bath for a patient who is unable to shower or bathe independently, which statement most accurately describes the primary purposes of this care activity? Option A. The main purpose of a bed bath is to rapidly decrease the patient's body temperature and reduce fever if the patient has an elevated temperature, as the water will cool the body and help bring temperature back to normal. Option B. The primary purposes of bed bath care are to maintain the patient's personal cleanliness, promote comfort and relaxation, provide an opportunity to assess the patient's skin for any changes or problems, and support the patient's dignity and sense of well-being during a vulnerable activity. Option C. The main purpose of a bed bath is to entertain and occupy the patient during the day so that they will not become bored while hospitalized, and to provide them with an activity to pass the time. Option D. The primary purpose of a bed bath is to prepare the patient for discharge from the hospital, as cleanliness is necessary before going home, and bathing should only be done immediately prior to planned discharge. The answer is B. Bed baths are performed for hygiene, comfort, skin assessment, and dignity, not for fever reduction, which requires medical assessment or entertainment. Option B accurately describes these goals. Option A is incorrect. A bed bath is not a treatment for fever. Water temperature is chosen for comfort, not to cool the patient. Option C trivializes the care. Option D is incorrect. Bed baths are provided regularly, not just before discharge. Great job! Don't forget to subscribe. Bye!